Good afternoon, everyone. Thank you so much for joining us, whether you're joining us in our Zoom room or if you are joining us on Facebook. Thank you so much for tuning in to today's program. It's time to talk navigating dementia care and palliative care in the African American community. My name is Nisha Tyler Carr, Program Services Coordinator and Certified Dementia Practitioner with the Dallas and Northeast Texas chapter of the Alzheimer's Association. I am joined by my colleagues, Angela Hodges and Kathy Shockley, who will just be helping me in the background with our program today. And I am joined by our esteemed speakers, April Herring from AuthoraCare Collective, Veronica Shanklin, and Garrett Davis from G. Davis Production TV and Film. Veronica Shanklin will be our community educator today, and we will be having, you'll view a presentation specifically giving you tips about having dementia conversations, those conversations that can be very difficult to have. We will also be viewing and premiering the Forget Me Not award-winning film, Forget Me Not. And after that film, we will have a panel discussion where you will have an opportunity to ask questions. We do ask that you keep your mics muted to avoid any background interference. And we do ask if you are comfortable, you can keep your camera on, but we are streaming live to Facebook, so you're more than welcome to keep your camera off. But please keep your, if you'd like to place any comments or questions in the chat, please do so. And when we have our panel discussion at the end of the program, we'll try to get to those as many as we can as time permits. So I'd like to kick things off and introduce your first speaker for today, which is Ms. Veronica Shanklin. One second. Veronica is a longtime community educator for the Alzheimer's Association, as well as the founder of her not-for-profit, specifically Dementia Care Warriors. And Veronica has a wonderful story to also share about just her experience as a caregiver. So Veronica, I am going to kick this off to you. Thank you so much for being here.
Thank you, Tanisha. Thank you for having me. Thank you to everyone else for being here. As Tanisha mentioned, I am the founder of a nonprofit called Dementia Care Warriors, and I'm also a caregiver myself. I've been a caregiver for about 8 years for my mom and my grandmother, and so I'm very familiar with these conversations that we're going to talk about today. And I think I'm probably going to go ahead and get started. So let me get my technology settled here, and I will get started. Okay. Welcome to the Alzheimer's Association Dementia Conversations program. This program is designed to help you talk with your entire family, including the person exhibiting or experiencing symptoms of dementia, about some challenging and often uncomfortable topics related to Alzheimer's and dementia. These discussions may not be easy to have for you and for the person exhibiting or experiencing the symptoms, and there is the fear of hurting their feelings or facing challenges related to aging and dementia, and being forced to deal with difficult family dynamics. You may want to try to wait until the time is right to have these conversations, but in reality, that time rarely occurs. The sooner these discussions can take place, the better. This way, the wishes of the person living with dementia can be included as much as possible, and unexpected situations can be avoided in the future. And one thing that you'll hear me say a lot, probably throughout this presentation, is that I always encourage people to stay on the offense and not the defense. So you want to get ahead of these problems and issues that may be down the road by having these conversations now. So this changing needs of the person often signal that it's time to talk. We've heard from many people who tell us that some of the most difficult conversations they had with their parent or family were about going to the doctor to get the diagnosis or medical care, deciding when it's necessary to stop driving, and also making plans for managing financial and legal documents to be sure the person's wishes are carried out and the cost of future care are covered. So keep in mind, as we talk about each of these conversations, we offer a variety of approaches. Not all of these approaches will work for every person. The approach that will work best for you will involve involve your customizing it to fit the needs and preferences of the person exhibiting symptoms and your family. So in today's program, we'll provide tips on how to break the ice and have the most common difficult conversations. We'll help you plan ahead and build a care team that communicates well, and give you the opportunity to hear from people who are dealing with similar issues and connect you with helpful resources. You may not think of yourself as a caregiver, but you may be noticing some changes or signs in the person you care about that are causing you concern. So often we find ourselves avoiding or talking ourselves out of difficult conversations around these issues for several reasons. Sometimes our family members say they don't need our help, or we assume that other family members who live closer are taking care of things. We fear that we might take away the person's sense of independence, or the family disagrees about whether or not there is a problem. So the sooner the better. Next slide, please. The sooner the better. Do not wait for a crisis to occur before having these conversations, which is where being on the offense and not on the defense comes in. You can actually avoid a crisis by talking about the issues and taking action in advance. By talking early in the disease process, you'll be able to hear directly from the person living with dementia about his or her wishes, while the person can still contribute and be a part of the planning process. Despite the difficulty of these conversations, they need to take place to ensure the person's safety and well-being. Successful conversations start with being prepared in advance. So develop a plan for how to finesse the conversation, how to introduce the topic in a way that will be gentle and minimize resistance. The use of finesse goes beyond honesty. It involves understanding how difficult this conversation can be and thinking about how best to gently position the discussion for a positive outcome. Also, consider what you will do regardless of how the person responds. For example, ask the person whether he or she would want to know if you've noticed any changes in functioning. In most cases, the person will say yes, thereby allowing you to begin the conversation. If he or she says no, that he or she would not want to know about what you've noticed, focus on the fears that accompany these changes and how important it is to talk about the changes openly. The actual conversation about the changes you have noticed may need to take place in a separate conversation. Also, take notes about the changes you see. Begin observing and note examples of behaviors that concern you. Take notes after you see something of concern so you can accurately talk about what you've noticed. Write things down so you do not forget the important points you want to cover, and bring those notes with you when you have the conversation. Be prepared to talk about your own feelings. Use I statements and try to avoid any suggestion of blame or criticism of the person so he or she is less likely to get defensive or angry. Also, be gentle in your discussion, keeping the person's feelings in mind. You want to avoid having the person with changes feel ganged up on. Practice in advance. Rehearse talking about sensitive topics with other family members, and that'll help you feel more comfortable when you have the actual conversation with the person exhibiting or experiencing symptoms of dementia. Consider possible solutions to offer during the conversation. And then finally, initiate the conversation at a place and time when the person is relaxed, well-rested, and comfortable. Sit close to the person, use empathy, and speak from your heart about your concerns. When someone in your life exhibits changes in thinking or behavior, it's important to be aware that they could be signs of Alzheimer's or a different type of dementia. There are changes that are typical of aging, such as taking a longer time to remember names or needing a reminder about how to use the remote control. But as you start to notice issues that go beyond typical aging, like that the individual is getting lost in familiar places or withdrawing at social functions, asking the same questions repeatedly, or forgetting recent events. People with dementia typically first recognize signs that have to do with forgetting how to do the things they used to do with ease, such as managing money or remembering appointments. Conversations can go more smoothly if reference is made to these changes rather than those that the person has not noticed him or herself. Sometimes a person may be reluctant, fearful, or angry when you encourage them to seek help. This can be because of his or her feelings about the disease or because of the effects of the disease itself. It can also reflect his or her cultural traditions, beliefs, or stigmas about the disease. But we have some tips and tools that can help you get the individual to the doctor. It can feel awkward to approach someone about the changes that you've noticed, but many times the person has already noticed these changes him or herself and has some concern. The person may be afraid, and denial is one of the most basic ways we all have to protect ourselves from being overwhelmed. But the changes might be due to something other than Alzheimer's, and acknowledging this can help the person agree to take action. And I always say that that's one way to get the person to the doctor, because it might not be Alzheimer's. It could be hormones, it could be menopause, it could be medications, it could be a number of things. So it's always important to maybe take that approach and say, let's just go see what it is, because clearly there's something going on. Next slide. Suggesting a doctor's visit can be all that is needed to get the ball rolling. Other times, just being honest and direct isn't enough, and the person needs more support or direction. Here are some ideas that might help. Use words that are most comfortable for the person. Be aware that the person may be sensitive to particular words, such as Alzheimer's. For example, you can say, let's talk with the doctor about the fact that you're having more trouble doing some things than you used to, rather than we need to have you see a doctor to do an assessment for Alzheimer's disease. So you don't necessarily have to take that direct of an approach. You know your loved one, and what might work well with them. Also, let the person know that it's time for an annual wellness visit. So the annual wellness visit, which has been offered at no charge by Medicare since January of 2011, is a visit for developing or updating a personalized prevention plan that can help prevent disease and disability. It includes an examination of the patient's cognitive and behavioral changes that may indicate a form of dementia or Alzheimer's disease. Many older adults have not heard of this benefit, but taking advantage of it can be a way to get a person to have their cognitive evaluation. So there is an annual wellness visit that is covered by Medicare. So perhaps you can take that approach. Next slide. Pair going to the doctor's office with an enjoyable outing. You may want to suggest going to see the doctor and then doing something enjoyable together, like having lunch at a favorite spot, or going to visit a friend who you often go see. So doing something like that might be helpful. And then also invite family to communicate concerns and questions to the doctor as well. So whether you're able to be there for an appointment or not, you can prepare a list of your concerns and questions and provide that information to the doctor before the appointment. And even if you are able to get information to the doctor, they may not be able to discuss with you further due to doctor-patient confidentiality and protections under HIPAA. So if your family member agrees to it, it can be very helpful to get a signed release of information that would allow the doctor to communicate directly with you. The release can be signed at the doctor's office. This is definitely something, if your loved one has been going to the doctor by themselves and you want to make sure that you're included, on the information from those visits, then you would need to get that release signed. And then finally, if they're still reluctant, try using a therapeutic fib. I also refer to those as fiblets. There may be times when the person exhibiting or experiencing symptoms is extremely reluctant to see a doctor, regardless of your attempts to use reason. Person exhibiting or experiencing symptoms often experience a reduced ability to use good judgment and make good decisions. So sometimes this contributes to the person's reluctance to go to the doctor. In these situations, the person's safety and care comes first. You may need to utilize a technique called the therapeutic fib to get the person to visit the physician's office. To get someone to see a doctor, some family members or friends tell the person that a doctor's visit is required by the insurance company or by the doctor in order to authorize prescription refills or renew a policy, etc. Invoking this outside authority can help the visit to seem less like a criticism of the person and his or her current level of functioning, so resistance might be reduced. So fiblets are something that can come in handy here and there. And a lot of people are like, I don't want to lie to my loved one. That's why they're called therapeutic fibs. They do serve a purpose. Next slide. So as we've heard from others, having a conversation about driving may be one of the first difficult conversations families need to have after diagnosis. You may notice signs that your family member's driving has changed, such as accidents or tickets for moving violations, or things that are more subtle, like new scrapes on the car or the garage. You may have even seen the person make mistakes while you were in the car. Even though many of us will need to stop driving at some point, people are often reluctant to consider the issue because they are afraid to relinquish their independence. Denial that anything is wrong can allow a dangerous situation to continue, but dealing with the issue early on can help ease the situation. Whether the changes in driving are due to Alzheimer's, a different form of dementia or not, here are some ideas that people found helpful when discussing this sensitive topic. Plan ahead before an accident occurs. Again, getting ahead of the game so that you're not responding to some disaster or some issue. Before changes in the ability to drive are seen, talk about the fact that the person will need to stop driving at some point. Many families find it helpful to have an open discussion and develop an agreement about how the person would like you to recognize that it's time to stop driving, such as noticing more mistakes on the road or new scrapes on the car. When the time comes, the person may not remember the conversation, so it can be helpful to write notes about your agreement to use later, or even ask the person to sign a driving contract, which is something that you would just make up and hopefully be able to use in the future. Also, express your concern about specific changes you notice. Let the person know that you care about and support him or her, and reinforce that as the reason for your concern. Use specific examples to show that these are real problems. Like, last week, you did something really different. Here's what happened. That concerned me. Also, appeal to the person's sense of responsibility and concern for others. For example, you could say, I know that you wouldn't want an accident to happen and for you or someone else to get hurt. Because as we all know, that is the definite possibility when people, are driving who probably shouldn't be driving. So definitely try that, and that might be an option as well. Establish a plan for alternate transportation in advance. So be sure to include transportation to places that will help the person maintain social connections and hobbies, such as going to stores, appointments, bridge club, or church. When you talk with the person, provide reassurance that you want to help maintain his or her active lifestyle and that those needs have been included as part of the plan. And it could be that you don't have to worry about going to church, Mom. I'll come by and get you for church, every Sunday morning, or your nephew will come by and take you to the grocery store once a week, or just having something already, in mind that will be a solution to if this person has to stop driving and where they will be able to keep their independence. Incorporate the voice of an esteemed professional and definitely have empathy. Ask a physician to write a letter or a prescription stating that the person must not drive. Use empathy in your conversation and think about ways to foresee and minimize the person's sense of loss. Consider talking about this from the standpoint of retiring from driving rather than giving up something. One of the ways that we all provide ourselves with choices that maintain our independence is by making legal and financial plans for our futures. Many families do this only to be taken by surprise when dementia enters the picture. Some people may have plans in place, but still may be uncomfortable discussing their financial status with you. You may also feel reluctant to do anything that may come across as intrusive. So talk about it. Making legal and financial plans early ensures that the person's preferences are included in the plans and that the family will not need to make rash decisions. Begin by explaining that you are in this together. These discussions may seem to go against some of our social norms and represent a shift in family roles. Understand that having the conversation will help you and the person living with dementia make the plans you'll need to get the best care and will allow you to connect and enjoy your time together in the future. It can be tremendously reassuring to let the person know that you will be a part of the process now and in the future. This way, the person you love can feel that you are on the same team. Start by asking questions and gathering documents. Thinking of the conversation as a chance to ask questions rather than to tell the person something. My grandmother passed in 2017, and honestly, we did not do a good job with this because years later, I still find things around the house that would have been helpful. I didn't find her will actually until a year after she passed. Like I knew it was here somewhere and I was digging through some bags and I happened to come across it. So having those things, you know, when the person can still help you find them themselves and help you get everything together, that's why these conversations are so important. Start by asking questions and gathering documents, but think of the conversation as a chance to ask questions rather than to tell the person something. So what documents are in place now? Where are they kept? Who has the copies of the documents and who should have copies of the documents? Who should review these documents? Family, professionals. Pull documents together and take care of any that need to be completed or altered. Explain that these are standard plans that need to be made as we get older. Reduce resistance to the process by explaining that these discussions and completing these documents are things we all need to do as we age. Try breaking the conversation up into parts and try different times and locations. So it can be a lot to come at someone with all of this at one time. So if you only had the conversation via phone, maybe try it in person also. You can also write a letter to get the conversation started. Maybe you send an email if they're active on email. Don't feel you have to cover everything in one sitting. It may help to do the planning in smaller segments. You can address the person's finances one day, then talk about legal documents at another time. So sometimes it's helpful to break it up and also involve others to help talk about finances. Perhaps ask a financial advisor to help with the conversation, or maybe involve a sibling. Some families make decisions to pool resources to ensure that care can be provided and the expenses paid. It is important to understand the financial situation so your family can help you make the best long-term care choices. So just as having these difficult conversations is challenging, caring for someone with this disease is also a challenge, but there are steps you can take to make things easier for everyone involved. As a veteran caregiver will tell you, no one can do this alone. I will tell you that as well. Everyone who provides care for the person is part of a team, and care teams work best when there's good communication. So the first step is to begin the conversation by talking with the other people on the care team. And so as with any team, your care team works best when there is an open flow of communication and when decisions are being made together. You, the person living with dementia, and your other family members are at the center of the team. And whether family members live near the person you're concerned about or far away, everyone can participate. Families can typically look to their primary care doctors to help with making medical plans. Other medical professionals who specialize in the area of dementia may be included to make a diagnosis. Once a diagnosis is made, find out who will coordinate care on an ongoing basis. And your care team does not stop there, because then you also have peers. Peers can be a tremendous support to the core team. As the disease progresses and care needs increase, friends can offer much needed breaks and emotional support. And everyone on the care team that continues to work should contact their company's HR department or employee assistance program to ask about caregiving benefits. Families can then look at their pool of resources and make decisions about how to proceed. There's also community resources available where you work and live, like the Alzheimer's Association and other agencies. Some are even online, so your entire family can have access to information and support. And then finally, the Alzheimer's Association Navigator is a tool that allows your family to create a personalized action plan to connect you to local resources, information, and support. And you can find the Alzheimer's Navigator at aoz.org/Alzheimer's Navigator. This is just one of the many resources the Alzheimer's Association provides for people going through the most difficult periods of their life. On the resource list that you should receive today, you will see the programs and services of the Alzheimer's Association, and they're all listed on the website at aoz.org. Take the time to explore the website, check into the resources that are available through your local chapter office, and begin a conversation with your family by sharing the free Alzheimer's Association resources. Remember that no one can provide all of this care alone, and the sooner in the disease process that you have these conversations, the more smoothly the team can function to provide assistance. Helping the person you're concerned about begins with taking and having these difficult conversations. There's also not only the website, which is aoz.org, but there's also a 24/7, 365 helpline number that's toll free that you can call at any time to ask questions about resources, or you can even call to vent about a problem you're having, and they can point you in the right direction to get the help that you need. We are here to help you, your family, and anyone you know who is affected by Alzheimer's and dementia. And that helpline number is 800-272-3900. And thank you.
Veronica, thank you so much for that very informative presentation. And thank you so much for being here. I'm excited to hear your perspective and your story at our panel discussion a little bit later. So thank you so much.
You're welcome. Thank you for having me.
Absolutely. All right, I am going to kick it off to our next presenter, Mr. Garrett Davis. Garrett Davis is the CEO and founder of Davis Production and Films and TV, and also founder of the Forget Me Not Project. And Garrett, I just want to thank you so much for being here, and also for allowing us to premiere this wonderful Forget Me Not film, specifically talking about palliative care. So I just wanted to kick it off to you to kind of do a brief introduction to the film before we view it. And I will kick it off to you now.
Okay, thanks a lot. Before I get into that, I just want to thank Veronica for that presentation. You know, a lot of times, Veronica and those that are listening and those that are on the panel, you know, the ones that we really need to talk to are not here, but every caregiver has somebody. And so what my challenge would be is that if you know of a caregiver, you know, they're probably too busy to be watching this, because what are they doing? They're caring for their loved one. But everybody needs somebody. And so I think that if we can challenge those, that if we know of a loved one who's caring for someone, let's make sure that they get that information. Because, you know, if I'm caring for my mother, if I'm caring for my father, the last thing I want to do is go to an Alzheimer's program, because I deal with Alzheimer's every day. And so I think, you know, we need to think outside the box, and we need to implore that the friends of those caregivers get the information that they need. So let's make sure that we do that. And that's the reason why I do what I do. You know, we started the Forget Me Not Project probably about 12 years ago. And it was designed to raise the awareness of Alzheimer's in the African-American community. And what happened was, Thelma from Good Times, known as Bernadette Stannis, her mother was going through Alzheimer's disease. I had lost my grandmother, and now I'm taking care of, you know, one of the caregivers, my sister, the primary caregiver for my mother who has Alzheimer's disease. And so we all know, you know, on this call, that Alzheimer's disease can be one of those diseases that strips you of your dignity. And a lot of times we don't ask for help until it's too late. That information that Veronica gave out, you know, we don't have it in time. And so that's why I think it's very important for us to do our part to make sure that we have those difficult conversations. All the resources are available to us for free. All we have to do is make sure those resources get into the hands of those that need it. You know, we say palliative care and hospice. Those are two words that I think in our community, in the African-American community, we don't want to discuss. And so how do we get that message across? Because a lot of times, because we're a private group of people, we don't want to have those conversations. We think we can do it all, we can handle it all, but you have no idea what you're up against if you've never gone through something like this. And so I think that, you know, the information that the Alzheimer's Association has is very important. And so this particular film that you're about to see is about 30 minutes, and it deals with, I play a character called June, and June is in the early stages of Alzheimer's, but my wife is dealing with cancer, the late stages of cancer. And we all know when it comes to Alzheimer's, it's not a disease that if you're not paying close attention to, you know, there's subtle signs that you can miss. You just think, well, you know, back in the day, they used to call it senile, you know, and so I think there's so many names for it. But, you know, in our community, a lot of times it can be overlooked because there's subtle things that are taking place that we don't notice. And so in the film, you know, all the attention is on my wife who is, is battling cancer. And so all the subtle signs and all the other things, aren't viewed and aren't taken care of, right away. And one of the things, there's always somebody in the community. There is always someone in the family who understands what's taking place, but they may not know how to communicate that. And so when it comes with this palliative care, there are always agencies and resource information in our community, but because we have myths and because we have already opinions about it, we don't want to deal with it. And then it's always after the fact when we hear about a story, we hear about someone else going through, and we say, oh my gosh, I wish I would have done that. And so that's why we created this film, because we wanted to get on the front side of someone seeing what palliative care is really all about. So we hope you enjoy it. And then, we're looking forward to having a conversation, after you view it. But, right now I'd like to present to you Forget Me Not. And this episode deals with palliative care.
They always leaving her food around here. Hey.
Daddy, what are you doing?
What do you think I'm doing? Trying to fix me something to eat? I can't wait on you. If I wait on you, I ain't gonna never eat. My stomach will be in my John Brown bag.
Daddy, you ate just less than 2 hours ago.
Hey, Mom. Hey, so we're having senior skip day on Monday, and I need to be counted present early, okay? So please tell me that we're going straight home after church on Sunday, please.
Hey, why don't you not go and say you went? Because that don't make no sense to me. I mean, is the day Sunday? Y'all going to church?
No, it's Saturday, Grandpa, and why are you eating again?
Well, y'all tell me going to church today, ain't you?
Never mind.
Look, okay, Brenda, look. I'm not right now. I just don't have time for this. I'm preparing your grandmother's medicine.
Mm-hmm. Oh,
Hey, Mr. June.
what up there, girl? What happened?
Hey, oh, you're eating oatmeal with bananas.
Mhm, yeah.
That's healthy.
Yeah, right.
¿Por qué tu papá siempre está comiendo?
Hey. I was in Vietnam. Don't you think I don't know what you're talking about?
Mr. Jude, I don't think that we're, talking Spanish in Vietnam.
Miss Henny. Damn it. I don't think he was there.
Daddy. Look, this is his second breakfast. Earlier, he had pancakes, toast, bacon, and eggs.
Where does it all go?
They put you like that.
Oh, God. It's funny.
Brenda,
Yes, ma'am?
can you come sit with your grandfather while I check on your grandmother?
Poor thing.
I'm gonna need to get paid if I'm gonna babysit.
Who you calling a baby, huh? Who you calling a baby? I don't want no baby. I don't know.
He is so funny, bro.
Hey, honey.
Hola, Miss Kizzy.
Hola, Tammy.
Oh, te ves bien.
Of course I do. This ain't my deathbed yet, Tammy.
You are too funny to me, Miss Kizzy.
Muy bueno, gracioso no eres.
Mama, how are you feeling?
I'm good, baby. Oh, wait a minute. Where's your daddy?
He's out on the patio eating breakfast again.
What? I can't do this. Lord have mercy.
Mama, what do you want me to do? Go out there and tell him he's already eating?
No, baby. You know what? The last thing anybody needs is someone to get into an argument with somebody who's got Alzheimer's, okay? Look, you know those are the effects of it, okay? So just do me a favor. Try not to have an argument with him. It only frustrates him and you. You know, we just can't help that.
I know, Mama. I know.
Nate, stop. Stop. I can do my own hair, girl. No, I'm not a child, baby. Remember, I'm the mama.
Mama, I'm sorry.
It's okay, baby. Intentando de ayudar.
Miss Kizzy, I still can't believe after all the chemo you have a head full of hair.
Thank you. To God be the glory. With him, all things are possible. Now, do what the doctors tell me to do, but I'm placing my destiny in God's hands, and that's all I need to do.
Amen.
Please don't talk like that. Please, Mama.
Nay, you're going to have to come to grips with it sooner or later, baby. When it's my time to go, it's my time to go.
Mama, stop. Okay? Just stop.
Dios mío. Tammy, do me a favor.
Yeah, anytime.
Tell que ella deje de mimarme.
Deja de mimarla.
You need to worry about your daddy, not me.
I'm right here. I hear the both of you.
Well, Nay, your daddy has Alzheimer's, and you need to stop being in denial. Look, you can't do everything by yourself, baby. You're going to run yourself in the ground. Nay. Nay.
I promise to talk with her, Miss Kizzy, okay?
Thank you, Tammy. That girl's just like her daddy. Head as hard as a 2x4.
I know. She's doing the best she can.
See?
Okay. Let me go check up on her, make sure she's good.
Okay. Thank you, Tammy. Come on in the room. Come on in the room.
Nay. Your mom looks so good. She does not look like what she's been through.
I just pray every day. I just pray, you know?
And that's all you can do. You know I know about the power of prayer, girl. But what I also know is that the more informed you are about an illness, the more empowered you are to deal with it.
You think I don't know that?
You're so close to the situation, eh? I'm just trying to help you see things from all sides, that's all. Okay? Hey, have you thought about palliative care?
Really?
I'm just speaking from my experience. Ever since I got Bobby into palliative care, his health has improved, his diabetes is getting better, and he's just doing amazing.
It is too early for this, Tammy. It's too early.
Ay, Dios mío, esta cabeza dura, ayúdame, por favor.
Will you stop calling me hard-headed?
Because you are. Why do you think I'm here, Nay? My best friend is driving herself to the ground. You're a primary caregiver for both of your parents, right? Mother to your daughter, working 2 jobs, a wife. You just have so much going on. I'm just trying to help you.
Look,
May.
I can't right now. I can't.
Would you consider talking to one of my friends and consider palliative care for your mother?
I don't even know what that is, so no.
Palliative care is a specialized medical care plan that helps people with all types of advanced illnesses.
Okay. No, just gonna tell you this. I am not putting my mother in a rest home. She is not dying. I don't care what the doctors say. I believe in God for a miracle.
Nay, who said anything about dying or a rest home? Palliative care just helps your mother with her way of life. Not counting the days until she passes. I mean, no, that's not how it works.
Your dad has diabetes. My mom has cancer. Don't you see the big difference?
I know this is hard. I know. Palliative care supports people with all types of advanced illnesses. People dealing with COPD, dealing with strokes, dialysis, and even cancer at any stage. Okay. I want you to talk to one of my friends from AuthoraCare Collective.
Authora who?
AuthoraCare. The reason why I want you to talk to her is because she can explain how palliative care works. AuthoraCare starts every relationship by recognizing each person's unique needs and the way of life. And that way they can help tailor a care plan for your mother, specifically just for the way she wants to live.
I don't know. I mean, this is a lot. It's just too much.
Look, you have a lot going on. I get it. But at the same time, you can't make the best decisions for your family when you're under stress. Right? You know that. You're a wonderful caregiver, but you are not Wonder Woman, ma'am. You know that.
Okay.
Okay?
Okay.
Okay.
You can tell her to come over here. But I'm not promising you anything.
Okay, well, do this for me. Can you at least be open-minded about it? Please? Do I have to tickle you?
No.
Well, I like that TikTok. You done taught Grandpa something. Hey, Tammy.
Hello, Mr. Jude.
When you get here? Hey, why don't you go fix us something to eat? You know what they say, bones meals.
Buenos
Yeah, bones, neck bones, and some guacamole. Yeah.
Did Grandpa just say fix him something to eat?
Go fix him some food, girl.
When 2 expert teams join together to provide even better care for you, that's quite a story. Hospice and Palliative Care Center of Alamance Caswell and Hospice and Palliative Care of Greensboro are now AuthoraCare Collective. Our purpose is to empower you to be an active participant in your care, enabling you to write more chapters of your life through our personalized support for mind, body, and spirit. AuthoraCare Collective and you. Your story, our expert care.
Where's you at now? See you in the house here. That's good.
Grandpa, you got company.
Hey there, Joe. How you doing, buddy? Good to see you, man. Good to see you, that boy. All right. See you still tinkering on this old car. Working on that SS. I hear you.
Mr. Bill told me that you and him were in Vietnam together.
That's right. 82nd Air Boom. That's right. Fort Bragg, North Carolina.
Son.
We used to jump out of the airplane. They'd open that door. That wind hit you in the face. Then you jump out the plane. Pull that cord. Boy, you get the sensation you was eating a York peppermint patty. We was part of the triple nickel.
What's the triple nickel?
555th Parachute Infantry Battalion. African-American unit of the United States Army. Proud soldiers. That's what we was.
Right. We used to jump out of airplanes together. That's
right.
The door went open. That wind hit you in the face. And we jump. Pull that parachute. Boy, we floating around. Woo! Then we hit the ground.
Then we hit the ground. I'm crawling up under the barbed wire. That's how I got this scar on the back of my neck.
You know, I think I've heard you tell this story 1,000 times, but I never knew you were in Vietnam together.
82nd Air Boom. Girl, we used to jump out of airplanes together. They pull that door open, that wind hit you in the face. Then we jump. Pull the parachute. Oh. Well, we just float. We'd get the sensation we were eating a York peppermint patty.
You might not want to say that again.
Say what?
Oh, don't worry about it, Jim. Look here. You hungry? Why don't you say we're going to get something to eat?
Hey, yeah, I'll drive.
Oh, what's his name?
She took Grandma to her doctor's appointment.
Well, how's she holding up?
You may want to ask her when she gets back.
Okay.
Hey, Brenda, go ask Nate where my keys at, because me and Bill need to go.
He is not supposed to be driving.
Look, I got it. Look there, Joan. You can ride with me this time. I'll ride with you next time, okay? Come on. Come on.
I'm sick and tired. Every time I turn around, they messing with my John Brown keys.
Oh, don't worry about it, man. I'll ride with you next time. Come on, I'll meet you inside. Come on, Brenda. How long June been sitting down in the car like this?
Every day he comes back here to this backyard. You know this car ain't ran in years, don't you?
Yeah, I know, baby.
Hey, y'all gonna smack your gums talking or smack your gums eating? Let's go.
We're coming, June.
Dad has always been the rock of our family and our family farm, but he has heart disease that's getting worse, so I moved back home to care for him. It's a lot to handle alone. That's why I called AuthoraCare Collective for help. AuthoraCare provides expert support for Dad and me at any point during his illness. They keep his symptoms under control so he can still enjoy life on the farm. Plus, they've taught me how to be a better caregiver. I cherish this time with Dad. Why not see how AuthoraCare can help you?
Why does Grandpa sit in a car that doesn't even work?
Alzheimer's is a complicated disease, baby. It affects everyone differently. But just know that deep down inside, your abuelito will always love his little baby.
Before this Alzheimer's started, Grandpa and I used to go for drives around the park.
I know, but guess what? Now you can take him for a ride. And that way you still get that quality time in, and I know he would really enjoy it. It's gonna be okay.
Hey. So when is that lady from Authority Collective?
It's
What?
AuthoraCare Collective, Nay. She's actually here now. Let me go get her.
Okay.
Mom,
Yes, baby.
are we putting Grandma in a nursing home?
No. Not at all. We're just having her to come over here and talk to us, okay? It's about Grandma's care. That's all, okay? All right. Look, go check on your grandmother and make sure she's okay while I talk to Miss Tammy and the lady, okay?
Thank you for coming. Put your phone down. Come on, let's go meet Nay. Nay, this is my great friend Dee Curry from AuthoraCare Collective. Dee, this is my best friend Renee. Have a seat.
Hey, how are you?
All right.
Thank you so much for coming by. I wanted to know if you could shed some light on the program that you have.
Absolutely. How's your mom?
She has a good days. She has a bad days. She's just holding on.
Well, can you tell me what the doctor said were her options?
Well, she's taking chemo and radiation, but the doctor said that she may need assistance at home.
Okay.
Well, it sounds to me like your mom would be a great candidate for our palliative care program, which is where the nurse practitioner comes here to this home and sees her on a regular basis and acts as the eyes and ears for the cancer doctor.
So when you say the nurse practitioner comes up and be the eyes and the ears, what does that mean?
Well, simply it means that the nurse practitioner will tell the doctor everything that she sees when she comes here for a visit. She will report any physical changes, she'll report any medication changes and needs, and she'll address any pain and symptom concerns.
Nate.
Yes, Daddy.
Who is it?
This is Dee Curry from AuthoraCare, Dad.
She in the kin of Steph Curry? What's she doing here?
She's just talking to Nay about palliative care, Mr. June. Just trying to get Nay some help, that's all.
Oh, that's all. I'm just trying to get some help. Well, don't y'all sign Jack until we find out how much it costs. Because we's on a fixed income. Just like that dog across the street. Fix.
Well, honestly, Nay, your dad brings up a really good point, and I can talk to you about the cost of our services if you'd like.
Please do.
So, most insurance plans actually cover the services, but just like when you go to the cancer doctor, if you have a copay, when the nurse practitioner comes, you'll have a copay. But just know that we will not turn anyone away for the inability to pay.
Okay.
So, essentially, Renee, palliative care is it's an additional layer of care and support for your mom and for your family.
Oh, wow. Thank you so much. This has been so helpful. Thank you.
Nate. Who is that?
It's okay, Nate. Lord, help me.
Okay, Nay. It's okay.
Lord.
Wow, that was phenomenal. Thank you so much, Garrett, for sharing that with us. Wonderful, compelling information. I am going to get us started with our panel discussion. So give me 1 second while I spotlight everyone. All right, everybody. Well, first of all, once again, fantastic, fantastic film. I wanted to kick off the first question about this wonderful program to Mr. Garrett Davis. What is the mission of Forget Me Not? And can you tell me how you got started with your partnership with AuthoraCare Collective?
Well, the mission of Forget Me Not is to create projects in an attempt to close the health disparities gap in communities of color. You know, when I introduced the film, you know, in our community, if we said grandma had sugar, if you're not from our community and you're thinking, you know, mama got something sweet, but you know, that's diabetes. And so how can you create, I think I want to create programs that meet people where they are. And so we say palliative care, but what is palliative care? We say caregiving, but what is caregiving? I think a lot of times people learn differently. And I think if we can show through a play or through a film what exactly we're talking about, then the next time that person is faced with that situation, then they may say, you know what, let me call Tanisha or let me call Veronica and get that information. Because I think now that I've seen it, I got an idea of what it is. A lot of times we're not comfortable talking. You know, believe it or not, we're just not because we're so private. We don't want people to know our business. And then partnering with April was important because I'm not an expert on palliative care. And April and AuthoraCare Collective, you know, that's what they do. So I wanted to talk with them to get a good idea of what are the myths, what are the things that people struggle with, especially in our community. How can I put that in a film? And how can I show it so that it'll make that conversation much easier so that maybe after someone watches this, they say, you know what, maybe we do need to kind of look at this differently.
Absolutely. Well, the comments are ablaze with just compliments about this film. I want to kick the next question off to April Herring, who is the community outreach educator for AuthoraCare Collective and also Faith Community Liaison. So April, thank you so much for joining us for this program this afternoon. I wanted to ask you to kind of maybe expound a little bit more on just your partnership with the Forget Me Not Project, and then also wanted to talk to you about just the common misconceptions and myths that you hear about palliative care.
Absolutely, Tanisha. Thank you so much for having me, and thank you to all of you for the great work that you are doing. My partner, Garrett, thank you so much for your partnership. But yes, as Garrett talked about, we came together. This was very, very special project. And when my team and I back here at AuthoraCare in North Carolina, when we began to talk about possibly using theater arts, the performing arts, as an outreach tool, primarily in diverse communities, underserved communities, it was just the first thought. The first person to come to my mind was Garrett and his organization, because Garrett's well known in our community for his great work, his creative skill, and also what was so important to us was not only he well known for his work in theater and in arts, but also for his community engagement, promoting health advocacy. And that's the type of partner that we wanted. So it was just a no-brainer. He was just a natural person, the first person that we reached out to. And so this has really been a very innovative collaboration, and is really just getting started. And we're just so happy that you all have us here today, and that we are able to preview it and premiere it today. But yes, when we talk about palliative care and hospice care, and oftentimes those two go together. They're not the same, but a lot of times they are packaged together. There are so many myths, so many misconceptions. I wouldn't even be able to, use the time that we have allotted today to talk about all of them. But I think, first of all, just really having an awareness of what palliative care is and what it is not. I was reading in the chat, and a few of our participants today, a few of our caregivers already know what palliative care is. They're familiar with that. And that's what we want. We want to promote awareness of this service. Palliative care is a specialized medical care for people with serious illness. Now, depending on the state that you live in or the organization that you contact, there may be different palliative care models, but essentially the primary objective of all palliative care service is to provide symptom relief, pain management, and also to address the stress, not just the stress of on the person who has the illness, because being sick can be very stressful, but also addressing the stress of the care team that Veronica spoke about, the stress of not understanding really what this illness is about and what the future of our loved one or the future of our family may look like. And when there is, at the time of diagnosis, there is often many questions, but not a lot of answers at that time of diagnosis. So that's what we really want to address. We want to address also the fact that when a patient and their families are able to establish goals of care, that gives them a little structure and also gives them authority. It empowers them in their particular situation to know that this is what I know, this is what I don't know, but this is what I'm going to find out. These are my goals. This is where I want to be. This is where I see myself. I want to, even if it's just getting out or going to my granddaughter's graduation, I want to be healthy enough to go to my granddaughter's graduation or a baptism or something very special in the lives of these individuals. And I think the last component really worth lifting up as far as palliative care services is that under these services, we always make sure that we talk to the patients and the caregivers about advanced care planning. So very important. Having those medical directives in place, having that living will, having that healthcare power of attorney, someone who can speak on your behalf if you're not able to speak any longer speak on your behalf. And So just having a basis of foundational knowledge of what palliative care is and what it isn't. It differs from hospice care primarily in the fact that with palliative care can begin at the point of diagnosis, the very first day of diagnosis, and that palliative care team can begin to assist the patient, the loved one and their family with that illness and with their goals of care, symptom relief and pain management. But there is no prognosis attached to palliative care. However, with hospice care, there is. There is a 6 months prognosis. That means that 2 doctors have come together in agreement saying that this particular individual, this patient, if their illness, their disease continues on its natural path, then this patient probably will not live longer than 6 months. And so that is the basic criteria for hospice care. So with palliative care, it is just so, it's such a wonderful program, because at the diagnosis of neuropathy or heart disease, COPD, liver or kidney disease, I mean, HIV, AIDS, strokes, there are so many things that really, really afflict our people, our culture a great deal, that all of those are under that scope of palliative care criteria. So when we're thinking about myths and misconceptions, I think one of the primary misconceptions about palliative care specifically is that it is not affordable. And that is not true. That is a misconception. And very often, as you heard in the episode there, very often these services are covered by Medicare, Medicaid, and most private insurances. And, we are very fortunate at AuthoraCare here in North Carolina that we are a nonprofit. And because of our nonprofit status, and also because of our wonderful community donors, no one is denied this care because they can't afford to pay for the services. We provide care for people who are uninsured, people who cannot afford to pay co-pays or pay out of pocket. So we just make sure that the care gets to the individual, but we want to make sure that families and community members know about this service and know that it is affordable. So that's one of the primary misconceptions of palliative care. Another misconception is that these services are only needed at end of life. So we find that predominantly in diverse and communities of color, this population really waits until the last minute, waits until it's a crisis, waits until their loved one maybe has a month or a few weeks left to live. And so that experience is going to be very different from someone who has already been engaged with palliative care, someone who at the beginning of that 6 months prognosis began getting care for their loved one. So that is a big misconception that these services are only for people who are on their deathbed. And that's just not true. And the earlier the services, palliative care and hospice care services are implemented into the care plan for the individual, the better the health outcomes, And, I think about this all the time that, we've heard all of our lives, most of us, that what we don't know don't hurt us, right? We all have heard that. That's not true. What we don't know as people of color is hurting us. Not only is it hurting us, it's killing us. We are dying prematurely because we don't know about these services, because we don't know about palliative care and hospice care. So we really want to make sure, and especially with this project, using theater arts, using performing arts, I think that's just so brilliant, because our people are people who, our history and our culture really has been molded by stories and storytelling. So this is a really, it's a beautiful marriage, I would say, that we have here, that we are able to bring these two elements together and release it out into the community. And I think another myth, I think I would really want to lift up is that many people of color really think that hospice kills their loved ones, and I can't say it any more plain than that. And I know that's very blunt, but we hear that in the work that we do. I hear that in the community, that that, hospice came in and my father died, daddy died. Well, reality is daddy was dying anyway. Daddy would have died with or without hospice care, but daddy's quality of life would have been more often would have been better had he had these services on board. And so that's why we want to move more upstream and have people contact us earlier so that we can become part of that care team and undergird that care team and be an extra layer of support. And, we step into people's story. At AuthoraCare, we want to make sure that people are the authors of their own story. That's where AuthoraCare comes from. And they are empowered in their own healthcare journey. So what we bring to the table is our expertise. We're not going to bring the authority. That comes from the family and the patient, but we bring our expert care. And so when you have populations of people thinking that, hospice care hastens death, that is an instant barrier, right? And I think, Tanisha, I would say also, in just wrapping up my answer to this, that we can't really talk about the issue, the myths and the misconceptions without really lifting up and acknowledging the past abuse, right? The past abuse, the maltreatment of Black people in the healthcare system, the medical arena, everything that historically has been documented, those things that have come to light, those things that are still being done, that are, under the covers, the disparities that Garrett spoke of. We have to lift those up because that fear is real for many, many people. They fear and they have a mistrust of the healthcare system in general. And especially sometimes hospice care. So, we think that this project is really going to help to mend the fences, to rebuild the bridges with our communities, to let our communities of color know that this is a service that is for you. This is not something you should be afraid of, but this is something that we should welcome as people of color, trying to do our very best to take care of those that we love so much.
Wow. Thank you so much. I love what you said there. Just so many nuggets, but I love the way you said that, people are the author of their care. I think that's important for people to know that these services are available and that, these services, what you do in the community is really partner with families to make sure they get the best care. We have some great questions that are popping up in the chat, but before I get to them, I want to kick this off to Veronica. Veronica, I wanted to know if you could share about your caregiving story. And I know that when we talked, you have not accessed palliative care, but you have been able to you were able to access hospice care.
So I'll talk a little bit about my hospice care experience with my grandmother. So as I mentioned, I was a caregiver for my mom and my grandmother, starting with my grandmother, and then my mom was diagnosed a year later. The last 2 years of my grandmother's life, she was on hospice care. And the thing to me about hospice, as far as the time length, nobody knows if it's 6 months, if it's 2 days, if it's a year, or anything like that. So I think that's something to keep in mind. I think something else that keeps us from seeking that care is that we feel like we're giving up on our loved one. We feel like we're not fighting, fighting for their life, or, however you want to put it. And so I think one of the things that people don't realize is, like you said, the quality of life that can be enhanced and improved with these services for the caregiver and for the loved one. So our experience with hospice care it's really just me as the primary caregiver, because my mom is here, but she also has Alzheimer's. So she's more so here physically. She can help with lifting, in the earlier stages. She could help with, meals or things like that, but she's progressing as well. So it's really, just me, but having hospice care, having a nurse on call 24/7 if I have any questions, having all her meds covered, at one point we had a massage therapist, at another point we had a music therapist, we had a social worker, we had 5 days of respite care, which I ended up negotiating at a facility near our house that my grandmother was able to go to for 5 days, so my mother and I could have a break and Sometimes that meant we traveled, sometimes we were at home, but just having those services and having that support, and even all the way until the end days and that acute treatment at the very end with my grandmother, where it was just me and a nurse, here 24/7 for a couple days, and him explaining the process to me and explaining, the transitioning process and what was going on. Cause I would have had no idea. I would have just been sitting here by myself, trying to figure out what was happening with my grandmother. So having that support, I probably would not have made it through those 2 years trying to care for her and care for my mom without that support. And so I think one of the main things that we have to communicate is all of the resources that come with that. And something else that April mentioned is that people wait until the last minute. And I've had that situation with other people who I've told about hospice services, and they, their loved one passes, maybe within a week or within 2 weeks. And they're like, oh my gosh, I wish I had had them earlier. Oh my gosh, they did so much in those 2 weeks. If we had had them a month earlier, it would have been so helpful. So that's, something else to think about and something else that I totally agree with. And then the last thing I was going to say about the film, and so many things that I could relate to, and I'm sure that other caregivers could relate to, everything from my mom wanting to eat again, when she just ate, to the repetitiveness, of course, that we all know, and everything that I could just totally relate to. So that's what I wanted to share.
Veronica, thank you so much for sharing your story. And I think it is important for the care partners or just anyone who knows someone who is living with a diagnosis and may be considering palliative care, hospice care, just really a caregiver's perspective on just really the benefits. We've got some great questions in the chat, so I'm going to kick off this question. This can be for anyone to answer, but I'm going to kick it off to Garrett, and all of you can definitely add your insight. Does the panel have advice about approaching African-American families that have a loved one with Alzheimer's and dementia? I do outreach in a very small rural town, and a lot of times it's a very small family unit. I take resources, support group details, palliative resources to them, but I feel that, it may be an offense often. So I come from a tight knit family that doesn't always accept help. So I get it. I'm just looking for the best approach without offense.
So a lot of times, that's a very good question. A lot of times when it comes to Alzheimer's disease, remember, that's a disease that strips you of your dignity. And so right away, you don't want no one seeing your mother like that. So to give an example, let's just pretend I'm taking care of April, and April has Alzheimer's. And Tanisha, you have some information you want to share with me. I'm not letting you in my house. I don't want to, I'm just not. It has nothing to do with you. I'm not letting you in my house. But let's just say my best friend is Veronica. You need to get to Veronica, and Veronica will get to me. And Veronica will say, listen, I need you to listen to this. You need some help, Mr. Davis. So it's that circle of trust. Now, what happens is people don't like to jump through those hoops. They're like, I got the information, and if you don't want it, then don't take it, you don't get the help. That's why I call African Americans unreached people groups, because nobody like to jump through all those hoops to help us. But if you're going to help us, whoever you are, you got to understand that circle of trust. And so with that, so everybody has somebody. And a lot of times, that's why family members get upset when mother has five children and 5 can't take care of one. Because you got that brother that says, I can't see mama like that. I ain't going over there. And his sister is saying, that's your mama. And then before you know it, brother and sisters fighting each other. Because the help that you need isn't coming from the person you want it to come from. You can't make somebody do something. But you've got to understand those that are trying to help, those that are trying to offer services. You got to understand the circle of trust. And it's not helping the family directly. A lot of times it's going indirectly. It's going through the church, it's going through the civic groups. You've got to find a way to get that information to them. And if you're trying to do it directly, a lot of times that is not going to work.
Yeah, and I'll chime in, Tanisha, on that. Garrett, that was an excellent answer. And, he hit the nail right on the head, because it really is all about, at the end of the day, it's about relationship building and utilizing existing relationships. If you all noticed in the episode you just watched, it wasn't the palliative care expert that first introduced palliative care to the daughter, to the caregiver. It was her friend. It was her BFF, you know, so her BFF had a positive experience with palliative care. And so she was able to introduce that to her friend in a non-threatening way, even though there was still some resistance with the friend, with Renee, then still she got that message through to the point where, okay, now she was open to listening to and hearing from and being approached by the expert in palliative care. So it's, you know, it's so important to utilize those existing relationships, whether it's a best friend, a cousin, a church member or pastor, you know, partner with these people who already have a relationship with the individuals and with the families. And, you know, it's an old saying that people don't care how much you know until they know how much you care. So sometimes instead of taking a bag of pamphlets, I'll take a bag of groceries and say, you know, just thought you might need this today, or taking a gas card because I know you have to take, you know, your loved ones to doctor's appointments throughout the week, or your kids to school. Just taking something that shows that not only do I want your business as a client, but I want to meet whatever need you have. Whatever need you have, and showing people that you care on that level, I think really it opens the door for a relationship. But it's all about relationship.
Yeah, I totally agree. I'm just going to add one more thing. Because Alzheimer's is so prevalent in the African American community, and African Americans are twice as likely as their white counterparts to have it, a lot of especially older adults know a caregiver or know someone with Alzheimer's. So when you talk about approaching these other groups, that's why it's so important to not necessarily, I mean, yes, target the caregiver, but also church groups and civic groups, as Garrett said, and just getting in front of people and talking about the disease and talking about the services, because again, everyone has someone. So I definitely agree with that.
And I want to add to that. I mean, for those that are trying to help, I mean, I want you to really take a minute, take a deep breath, and think about the African-American family dynamic. I can only talk about the African-American family because that's where I come from. Let's just say a mother has 3 kids. She's not going to tell everything to all 3 kids, very rarely. There's usually 1 kid that knows everything. And so if she's not telling her own kids certain things, that's that circle of trust that you have to understand how to break that barrier and get into. But everybody has somebody, you know, that person that is hard to reach has a best friend, has a girlfriend, they have someone, and I think you have to kind of go that direction as opposed to, why won't they accept this help? I have all this information. You do, but you have to understand that circle of trust.
Thank you all so much. Great points, great tips. I learned some new things about just a different way to approach, but I definitely would just love to just absolutely resound everything that you are saying. I'm going to kick off this next question to April. How does a home health company work with a hospice company? And what are some components that you may look for when you're trying to find an agency that provides palliative care?
That's a great question. And with palliative care services specifically, home health agencies and home health providers work in concert. So unlike with hospice care, that's something that with under palliative care services that, you know, we encourage and we can work in concert. And I also saw a question about what happens to doctors and specialists under palliative care. Well, under your palliative care program, we work with your palliative care provider, works with your providers that are already on board with your primary care, with your specialists. And oftentimes, and I found this to be true in my own family with my 82-year-old aunt that I care for, oftentimes when palliative care comes in, they are able to act as a mediator. They're able to act as the go-between, because there isn't always great communication between the primaries and the specialists and the patient. So what the nurse practitioner does is kind of weaves everyone together and enhances that communication so that that patient can get the best information as quickly as possible whenever needed, or get the appointment they need as quickly as possible whenever needed, or the medication change that, you know, that a specialist may have change the medication, but the word didn't get to the primary. So that palliative care, it's like a conduit and a connector in there to be able to make sure that that patient is very much supported. But yes, under palliative care, the in-home care services are very much welcome. And we work in concert with in-home care providers. And I also will add that under palliative care services, the patient is, still encouraged and able to seek out curative treatments. For example, if someone has cancer and they have been on radiation treatments or chemotherapy treatments, then those treatments can continue under palliative care services. Now, to the contrary, with hospice care is more focused on comfort care without the those extensive and invasive curative treatments. So I hope that answer was sufficient.
Absolutely, absolutely. We have about 3 minutes left to our panel and panel discussion, and I wanted to ask from all of you maybe 2 takeaways you'd like to leave our audience today. So I will start with Veronica.
Thank you. Just with regards to this topic, I always encourage people to get an evaluation, get an assessment. All they can do is deny you and say no, and you can go back assessment or evaluation again. Because these services are out there. And when I say assessment or evaluation for care, for palliative care or for hospice care, because these services are out there and we do not take advantage of them. They are, so helpful, and just this is gonna sound dramatic, but life-changing for me. Like hospice was like, they were here in the clutch. So definitely just to encourage people to call up the hospice company, call up the palliative care company, and seek out those services. I just had one thing. That's it.
Thank you, Veronica. Thank you so much. Okay, April, your 2 takeaways.
Well, I would say, first of all, just keep talking about it. I love this platform. Let's talk about it. Continue to have the conversation. We need to communicate with one another. We need to be having these conversations in our homes, in our churches, in our educational system, in our, in the break rooms at our jobs. We really need to be having these conversations. The conversation is the key. Conversation is the key, and that can be on a lower level conversation, or it can be with a professional, as Veronica said. So keep talking about it, keep bringing awareness to it. And I think the second thing would be tenacious. You are your best advocate. You are your loved one's best advocate. Fight for them, even when you get a no, even when you're misunderstood, even when you don't get a call back, call again, or reach out to an organization and get help, get someone else on your team, but be very tenacious, because your life, your health, and the life and the health of your loved one is worth it. So just be tenacious and do the best you can every day. Give yourself grace, give yourself grace, give yourself grace.
Absolutely. I have a saying that I always say with my colleagues and my friends and family members: there is grace in this space. So you always have to do that for yourself and for others. And Garrett, your 2 takeaways?
If you are a primary caregiver, I truly believe you were called to be that. Okay. And if you're a primary caregiver, understand that you're not going to be able to get family members, brothers, sisters, uncles, aunts, nieces, whoever, to do what you want them to do. But if you're called to do that, because I just believe that, in the middle of the night, you get that call that says mama failed, everybody gets to the hospital, who ends up taking care of mama? Whoever lives closest to her and whoever is in that area. And so there's a reason you're a primary caregiver. And so I just want you to know, if you're a primary caregiver, number one, you're called it. Number 2, find a friend that you can release with. Because if you can't take care of yourself, it's gonna be hard for you to take care of somebody else. You've got to have a release. You've got to share. You cannot, you can't juggle all this stuff by yourself. I know you think you're Superman, you're Superwoman, but no matter how much money you have, no matter what position you have, when it comes to caregiving, if you don't break this thing down and get somebody to help you, it will break you down.
Absolutely. I concur. Fantastic information. Well, thank you all so much for being here and participating in our panel. And thank you, April and Garrett, for that phenomenal film.
Sure.
Well, as we are drawing to a close with our program today, I just wanted to thank everyone for being here. Thank you for your fantastic questions. And April, thank you so much for leaving that link in the chat. We're going to hang on a little bit longer after the program so anybody can grab those links. And also, I just wanted to let you all know, if you are interested in attending more programs like this, getting referrals to hospice and palliative care services in your local area, and would like to also be a part of any attend any caregiver support groups or any education programs that the Alzheimer's Association offers, as well as our partners, you can call our 1-800 number. It's 24/7. It's our Alzheimer's Association 24/7 helpline. And that number is 1-800-272-3900. You can also visit our national webpage, alz.org. And as a follow-up to this program, we are going to send you a follow-up survey. It's a post-survey. You have now viewed the film, so we'd like to get a quick 5-question survey out to you about the film, as well as I'm going to send you a participant Dementia Conversations tip sheet as a compliment to Veronica's wonderful presentation today. I will also be sending out the Facebook Live link to this program today so that you can share that with others. And if you have not already, please go to the Alzheimer's Association Dallas and Northeast Texas chapters Facebook page. We'd love for you to become one of our followers and get lots of great information about any upcoming programs. So thank you all for being here. I'm going to ask our panelists and staff to hang on towards the end, but thank you all for being here. Have a phenomenal afternoon. Thank you.
Thanks, everyone. God bless. Merry Christmas.